Yadin, Tom here. Good to be back with you.
Absolutely, Tom. Looking forward. We have great message to deliver today, and let's go for it.
Hey, this is the beginning of our second session today at the World Health Innovation Forum. And in the morning, a group of our friends talked about using the clinical engineering, biomedical engineering who serve at the point of care platform to encourage innovation with impact. It's not good enough to just have innovation. You have to innovate and lead to impact. And so we're going to share some success stories in that realm. Yadin?
And Tom, um, if you walk into a room full with a product and you look at it and somebody is telling you, oh, this is all new idea. These are innovations. And you say, wow, I could have thought about it. It's so obvious. And that's the idea of this discussion between you and me today, doing it together and making the point to understand that getting to the point where you can create a solution to a problem is the basic of engineering. Solve issues, remove barrier through innovation, overcome difficulty by having an impact. And we wanted to make the point with you today that we have example that it's not just another slideshow, but it's actually things that were created, adapted, and influenced.
So Yadin, we're going to talk about this from a global point of view. This morning, there were some folks that talked about the history in Latin America, some of the work in Nepal and China, and some other key places around the world. We're going to kind of give a global overview of how this innovation with impact has happened.
Exactly. And I definitely want to make the point that India is an area that included in this innovation story, especially when we get to the point of World Health Organization compendium that we will discuss.
So how did we tie our community, our discipline together around the world, Yadin?
So we have a good foundation to deliver the story about the need and the response to the need by collaboration. You and I collaborated with the clinical engineering division, and then in 2020 we start doing the creationing of a new association, the Global Clinical Engineering Alliance, and we continue this joint work to the point that we got more and more believers joining the village and becoming an innovators. And we have example for those from small start in China to a much larger seedling that starts sprouting in the field with CED and now flowering the whole horizon with the alliance covering almost every country around the world. But
Well,
at the
yeah,
same
you
time,
never were busy enough. So you started this little journal with the discipline behind you. A lot's happened with that.
and you're absolutely right. And what we noticed is that the dependence of healthcare services on technology to deliver programs is a trajectory that moving higher and higher and higher. And the dependence today is much higher than yesterday, and it's lower than what it will be tomorrow. Technological tools are the product that clinical engineers are familiar with. So we want to tell you the story about how that is happening. And the Global Clinical Engineering Journal is a great platform to bring the article, the stories, and survey data to show you where is happening, what and when relating to bringing innovation to the field, to the point of care. So the Global Clinical Engineering Journal is great go-to as far as resources, both conference proceeding and periodical journal, as well as research paper are now part of our domain there. And then we go to show you that the story actually became to be an evidence during the pandemic. During the pandemic was a turn of the highway towards center when we were looking for solutions and clinical engineer came through. So let's talk about some of the area that we covered during the pandemic.
Well, one thing is we had, those two congresses that we mentioned earlier during the pandemic. And of course, 2021, every 2 years, 2015, 17, 19, 21, and 23. And that in 21, we had to go virtual because COVID was rampant. And we had a great turnout, I think 130 countries or so. But we were able to get back together in 2023 in Vizag in India. And we were able to look at these contributing factors to our discipline, which had been fractured over the years, was really coming together. And what were the contributing factors to our discipline coming together that we highlighted in Vizag at the 2023 Congress? And the rise of national CE societies. Perhaps they started in a city, but then or a province or a region of a country, but they came to national CE societies. So people were sharing all these best practices and communicating them and writing about them. The rise of individual clinical engineering certification. That's a tough nut to do around the world, but we've been working hard on that. And, there's certain areas of the world where that's been done extremely well. I would say North America has done it pretty well. Certainly India in recent years, Japan, China, and other places, but individual certification so that there's a gold standard that ministers of health can look to us individually and see that we've passed a lot of tests like the physicians and other allied health professions have to do. Of course, then we've gone from regional now to global societies. I mean, Latin America, the individual countries, maybe they went to a regional group and now they've really joined the global community. And so continuing to look for those best practices around the world matters. And we've already mentioned the congresses. And I just give a little overview of the topics that we focused on in the fifth ICT HTMC a year ago. And you can see, dealing with pandemics, building capacity, measuring impact, credentialing of which certification is part policy at the national level, and HTA, HTM innovation, and so on, the Women in Clinical Engineering National Society. So this has accelerated these people telling their stories, being given a platform to tell their stories, has given rise to innovation. It was so prevalent during the pandemic, the need for ventilators. I mean, in 2020, the World Health Assembly said to the ministers of health around the world, where are the ventilators? And so many countries, many clinical engineers in those countries responded by building their own ventilators, but they had to meet strict criteria. And so these emergency use authorizations is one example of a lot of CE innovation in the pandemic. Yadin, anything else about this page?
Yes, we have the 12 subject, as you mentioned, on the right-hand side of the slide that were shared during the fifth International Clinical Engineering and Health Technology Management Congress in Vizag. And 2 points I want to make. One is we are very careful and mindfulness about the ability to congregate, to bring together people regardless of if you can afford it and you don't have enough resources. We make sure that we can remove the barriers and get as much people from as different a background as possible to get together. And having in Visag physicians, many local physicians, clinical engineers from around the world, biomedical equipment technician and administrator, nurses in the same room allow this conversation and presentation to rise above the medium to really high peak of highlighting the issues. For example, if you look at number 10, quality and risk management, you would say, what clinical engineers got to do with it? But one of the biggest barrier to innovation is regulation, which is part of risk management. Regulation is lagging behind innovation. We have new innovation, new material, new integration of software, hardware, middleware, both physically at the surgical theater and remotely in distance telehealth. all get together, but yet the regulations are not there yet. We need to get involved with this process, making sure that we put the feedback and the input into the regulatory agencies to make sure that they're catching up with the innovation that we talk about. So those 2 points I wanted to make is that we made point, and not many organizations can claim that, to bring association and members together without the requirement of major resources and make sure that they can participate. And we have variety of background, physicians, nurses, engineers, technologists. And for that, I must say that if you, as you talk about capacity building and credentialing on the left-hand side of item 2 and 4, it is our duty, it is the clinical engineering community duty to show that we are competent and credentialed. We need to move ahead with pursuing certification, both as individuals, as society, as well as hospital clinical engineering department program, and obtain this accreditation of where we are and what we do.
Yadin, as we wrap up here, I want to try to show a couple more things. First, you go ahead on this slide, but as you describe it, people can see that, you know, this dependence on technology you talked about is growing not only it's growing in every healthcare setting. It's growing in the hospitals, it's growing in the clinics, it's growing at home. And because not you and me, we're not getting older, but a lot of the population is aging, Yadi.
That's right. We sometimes call it aging at home as the average age of society is growing. There are tools that can help maintain quality of life and wellness regardless where you are, and delaying the need to rush to a hospital. And on the left hand side, what you see are the new sensors, the robotics, the ability to transfer information of vital signs through Wi-Fi to care providers, and make sure that people are following us both in the acuity, intelligence, as well as the physical condition of our body.
So, and last, not too good with the slides here, is we've had the privilege, GCEA, our part of the community, to lead and to work with WHO's medical device unit in a couple of ways. Yadin and I are particularly proud of not so much ourselves, but how we were able to engage the wider global community, particularly the LMIC community, with these WHO compendia in 2021 and 2022, where GCA was contracted with WHO to look at the engineering and management evaluation of 30-some products each year that made the final cuts in WHO's strict criteria. But we engaged 100 of our colleagues during those years to evaluate these innovations at home, you know, boots on the ground in the local settings to see if they could make the cut. Yadin?
Absolutely, Tom. And this is very important point to make about this compendium project. The World Health Organization issue a call for proposal for innovation to overcome the effect of the pandemic, COVID-19, and bring tools to help both diagnose, treat, and rehabilitate patients that are suffering from the disease. We review them, but we were smart enough not to act ourselves as innovators sitting in a room in a lab somewhere remote from the point of care and passing judgment, but our methodologies that we developed specifically for assessment of innovation and was adopted by WHO and documented in those compendiums that are available free of charge on WHO website. You can see the methodology of assessment and engineering critique that we provided, because we have this unique connection with boots on the ground at the point of care in low resource countries. That was very unique for Global Clinical Engineering Alliance to deliver beyond just sitting in a laboratory, think about innovation on a engineering bench, but actually bring the expertise of boots on the ground, of people working at the point of care in the facilities that are looking for those solutions. So there were ultraviolet light project that came from Poland that we identify risk with mercury. There were electron gun innovation that came from India that we identify the feasibility is physically not reachable yet. And we are able to put those methodology because we have engineers at the point of care in all those areas. And then we moved on to the right-hand side of the slide, where another innovation came about, and World Health Organization say, if we know all the surgical procedures that need to take place in low and medium resource country, can we identify what tools they need? What are the tools to provide those surgical procedure? And for surgical procedure involve orthopedics, we need A. For surgical procedure involving OBGYN, we need B. And those kits were developed, again, with the expertise of people on the ground, and we were able to deliver what we promise as 53 packs to populate the dictionary for World Health Organization. And Tom and I are extremely proud for being able to get this congregation behind us and give this seal of approval to decisions that are made relating to innovation.
So as usual, Yadin, fun hanging out, and more to come here in this session. Thanks so much.
Thank you.